Good afternoon. Today we have the Premier, Mr. Fraser, Dr. Behn Smith, and Susan Wannamaker in Vancouver. Just a reminder to the media, for questions, please press *1, and when the Q&A begins, we will try to start with on-topic questions. Over to the Premier.
Thank you, George, and thank you for being here today. We, of course, in Victoria are assembled on the traditional territory of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations. Susan Wannamaker is in Vancouver at our offices there, which is the territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. At the outset, I just want to acknowledge, as all British Columbians mourn the tragic deaths of so many people in Portapique, Nova Scotia, including the loss of Constable Heidi Stevenson, a 23-year member of the Royal Canadian Mounted Police. All British Columbians' hearts are just heaving with sadness at a time when we are already enduring some of the most extraordinary times of our lives. To also have to hear of tragedy and unthinkable violence against fellow Canadians is just really, really tragic. Today, the Nova Scotia flag will be flying at the BC Legislature, and the Canadian flag will be at half-staff in the memory of those that were lost, as all Canadians mourn the tragedies that took place across our country on our far coast. I want to thank Minister Fraser for joining us today, as well as Dr. Danièle Behn Smith, the Deputy Provincial Health Officer, and in Vancouver, as you've already heard, Susan Wannamaker, the Executive Vice President of Provincial Health Services Authority. COVID-19 continues to be the largest challenge of our time, and we continue to adapt day by day to ongoing operations of government, ensuring that we are making changes that are appropriate to provide services for people, but also all the while looking at how we can improve the delivery of those services wherever people may live. Every community in BC is working hard to keep people healthy and safe. Our efforts to break the curve and to bend it to a place where we can start to reintegrate into a more normal way of life is just around the corner, but it is a way away. That doesn't mean we shouldn't stop looking at how we deliver those services. And people living in rural, remote, and Indigenous communities have unique challenges accessing the health care that they need. Many people who are sick have to travel for hours to see a doctor. COVID-19 is adding pressure to an overburdened system. When there's travel to urban centers to get care, there are also costs that go with that. Hospitals, sometimes airline flights, buses, cars, gas, expenses. That adds to the stress for families who are already dealing with a health emergency. Many Indigenous peoples aren't able to access culturally safe and appropriate care when they leave their communities and go to larger centers for acute care. Minister Dix and Minister Fraser have been working on delivering primary care in rural, remote, and Indigenous communities since the day we were sworn in as a government back in July of 2017. Because everyone in BC deserves to have health care services delivered close to where they live. And if we can't build the facilities in rural and remote communities, we should make sure we have the ability to take citizens to those facilities. And today, I'm announcing a new collaborative framework for health care in rural, remote, and Indigenous communities. This will help immediately in our response to COVID-19, but the building blocks of this primary care initiative started, as I said, 3 years ago, and we've been working on it ever since. The emergence of the pandemic only highlighted the importance of ensuring that we have in place programs and policies that will make all British Columbians equal when it comes to accessing their health care. So what do we do to provide better supports into the future? The framework includes improved medical transportation options, which includes planes, helicopters, and 55 new ambulances to bring people from remote communities into urban centers where they can get the health care that they need. People in rural, remote, and Indigenous communities won't have to worry about how they get there anymore, and that will relieve some of the burden emotionally as well as the burden financially. And we're committed to moving patients at a moment's notice, particularly at this difficult time of COVID-19. The framework also includes self-isolation accommodation close to hospitals, faster and culturally appropriate COVID-19 testing methods. And Dr. Behn Smith will talk about that, as will Susan Wannamaker. Also, an acceleration of enhanced virtual health care. We are making great strides in British Columbia, led largely by the private sector in partnership with our health care deliverers to make virtual health care a thing of our present, not just a thing of our future. It allows us to spread resources farther afield to make sure that people in every corner of British Columbia can get access to the quality physicians, nurse practitioners, and other healthcare providers here in BC. I want to say thank you, a huge thank you, to everyone who has worked on this, particularly Mr. Fraser and Minister Dix for making this a high priority for their ministries, but the First Nations Health Council, the Rural Coordination Centre of BC, our regional health authorities, particularly Northern Health, and of course the Provincial Health Services Authority, all working together with people on the ground, rural, remote, Indigenous, non-Indigenous communities. By continuing to work together, we'll be able to get through this particularly challenging time, and our healthcare delivery, our primary health system in British Columbia, will be the stronger for it. I've said many times that out of this crisis and out of this tragedy for many, many people, whether it be their businesses or their families or their communities, we will be invigorated. We will be stronger as a result of the efforts we're taking today. This is one of those steps. And I'll now pass the podium over to Minister Fraser for a few comments, and then we'll move over to Dr. Behn Smith for some of the details on the appropriate testing and other issues that she's been working on. Thank you very much.
Thank you so much, Premier. Good afternoon. It's a pleasure to be here with all of you. I want to acknowledge the Lekwungen-speaking people, Esquimalt and Songhees First Nations, for allowing us to do our business today, and I'm grateful to do this work on this beautiful island and this beautiful territory. The framework we are announcing today is important for all communities in rural and remote British Columbia settings. And I want to acknowledge that Indigenous communities, especially those in isolated areas, have unique needs and circumstances in the face of the pandemic. Ever since settlers began arriving here about 150 years ago, Indigenous peoples, time and again, have been hit much harder by diseases and pandemics, and that has left lasting effects and fears. I've talked with many First Nations and Métis leaders in the past few weeks. They have shared their concerns about protecting elders, the knowledge keepers, and everyone in their communities, because many are vulnerable. They face challenges accessing health services, health conditions that put them at a higher risk, and often crowded housing situations in the communities. And I'm seeing how much we've learned. For Indigenous and all rural and remote communities, each one has unique needs, and help must be responsive to those needs. That is what this framework does. For many weeks now, we have been working across governments and across agencies to support Indigenous communities in their preparations. This is all hands on deck. And I'm seeing how much we've learned from working together on recent emergencies like wildfires and flooding. Our emergency response on COVID-19 has integrated First Nations and Métis like never before. It is about working together, government to government. And I want to take a moment to acknowledge the First Nations Health Authority and Indigenous Services Canada in this work. Their responsiveness and their dedication to safeguarding and supporting communities has been unwavering. Guidance with pandemic planning, critical supplies like personal protective equipment and food, coordinating staffing and training for health providers in communities, and of course funding. The measures in this new framework bolster the supports of all rural and remote communities, prioritizing rapid testing, accommodation where people can self-isolate both in community and in larger centres closer to hospital, and medical transport that will be there in their time of need. These are critical supports to all isolated communities in British Columbia. I will close by saying that I've heard enormous gratitude in my conversations and for the support for support from Indigenous leaders for the amazing work of Dr. Bonnie Henry, Minister Adrian Dix, and Danièle Behn Smith, and everything they've been doing. And as they've been telling us, we must continue to abide by the measures like social distancing to slow the spread. We are flattening the curve in British Columbia, and though we have not seen significant outbreaks in rural and remote communities yet, we must be ready, we must be vigilant, and that's what this framework is all about. It helps us to do these things as we face this pandemic together. I would also now like to introduce Dr. Danièle Behn Smith, our Deputy Provincial Health Minister of Indigenous Health, up to the podium to share some words of wisdom with you. Thank you very much.
Bon après-midi. I'm Danièle Behn Smith. I'm Etchodene from Fort Nelson First Nation, and I'm French-Canadian and Métis from the Red River Valley in Manitoba. I'm extremely grateful to be speaking to you today from the territories of the Lekwungen peoples. Our people have been healthy, balanced, and well for thousands of years. Since contact, we've shown our strength and resilience time and again against deliberate attacks on our ways of knowing and being, our culture, our language, the things that make us distinctly Indigenous. And we have faced ongoing systemic and structural racism and discrimination. As a result of colonial practices and policies, we come into this epidemic on unequal footing. An ethicist colleague of mine noted that coronavirus doesn't discriminate, but systems can and do. I believe that COVID-19 and our collective responses have the potential to promote equity rather than disparity if we come together with one heart and one mind with diverse Indigenous peoples. The work described here today is an excellent step in that direction. Earlier detection of cases with newer, faster testing and informed choices about access to higher levels of care will help decrease the impact of COVID-19, which, as noted by Minister Fraser, has the potential to be culturally devastating. Elders are the heartbeat of our community. They're our link to our ancestors, our teachings, and we need them to ensure cultural continuity. In addition to this great work, there are 3 other considerations that must be hardwired into our responses if we want to achieve equity. The first is that we must use distinctions-based approaches that honor the unique and diverse experiences amongst Indigenous peoples. Recognizing that First Nations, Métis, those living in rural, remote, and urban areas are different from each other and bring different perspectives and needs. Secondly, we need to hear and respond to the stories and needs of Indigenous women and girls, who we know, as a result of the Missing and Murdered Indigenous Women Girls Report, face higher rates of violence, which have only intensified during this stressful time of self-isolation. And finally, we need to use robust tracking using both Western and Indigenous data to illuminate whether COVID-19 responses are meeting the needs of Indigenous peoples in culturally safe ways. By this, I mean it's not just about the services we deliver, it's about how we deliver them. As healthcare providers, we need to be aware and respectful of the uniqueness of BC's diverse Indigenous people. Cultural identity is fundamental to our health and wellness, and it must be respected. In collaboration with First Nations Health Authority, Métis Nation BC, and BC Association of Aboriginal Friendship Centres, and others, our office is working to uphold Indigenous data governance principles and help create a clear picture of how COVID-19 is impacting Indigenous peoples in BC. I've been truly awestruck by the collaboration and relationship building that's taken place over the last number of weeks. During this unprecedented time, there are unprecedented opportunities to advance reconciliation and Indigenous self-determination. I'm hopeful that on the other side of this crisis, we can tell a story of how we came together in meaningful partnership with diverse Indigenous peoples to ensure equity, decolonization, and cultural safety. Masi Cho. I would like to now introduce Susan Wannamaker, Executive Vice President, Clinical Service Delivery with Provincial Health Services Authority. Masi.
Thank you. Please go ahead, Susan.
Good afternoon, everyone. As I'm joining today's event from downtown Vancouver, I would also like to start by acknowledging that I'm privileged to be presenting on the traditional, ancestral, and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm delighted to be part of this announcement today. For the work we are announcing, for the meaningful collaboration it represents, and for the meaningful access to care this means for people living in rural, remote, and Indigenous communities. Throughout my healthcare career, I've been privileged to work with different healthcare providers across the province, and I've seen and experienced the impact of timely access to care at every stage of the patient's journey. There's no denying that when it comes to access to care and access to critical care, be it related to COVID-19 or other life-threatening situations, that minutes count. And not just for our patients, but for our care providers themselves, who understand that the positive impact they might have on someone's life often increases the sooner the patient's transportation can be merged with the care at hand. As we've heard, we are managing in a new reality in the midst of COVID-19, and this has sparked forward momentum on much-needed transportation resources that will serve our patients both short and long term. As Premier Horgan has already shared, today's announcement involves a number of tangible service improvements for British Columbians living in rural and remote communities. With respect to BC Emergency Health Services, this involves significant additional resources for our transport fleet, including 55 additional ground ambulances across the province, and to highlight, 5 of those will be put into the Northern Health Authority, and 5 additional provincial air resources, both fixed wing and rotary, with others as we need. Initially, this expanded network was activated as part of the COVID-19 surge planning, enabling and supporting the swift connection of people living in rural and remote to higher levels of care. But thanks to thoughtful, evidence-based planning with partners across the province, these resources will remain in place long-term, ready for repositioning as required to meet local needs. PHSA and BCEHS are excited to be working as part of this partnership with the BC government, with our regional health authorities, with the First Nations health authorities, and our Indigenous leaders across the province. As we shift from surge service delivery to implementation of long-term resources, we are actively moving on the next steps. This includes continued engagement and collaboration with the health authorities, First Nation health authorities, and our other Indigenous partners. Human resource planning and implementation is critical, as is engagement with our union partner QP 873 as a key component of this. Our team is truly excited at what this announcement means for rural and remote communities, our patients and families, and our paramedics. In closing, I'm mindful of a well-known African proverb that rings true today. If you want to go fast, go alone. If you want to go far, go together. Arguably, we are also moving fast in light of COVID-19, but the partnership behind today's announcement means our expansion of BCEHS services will be impactful and lasting. Finally, I'd like to thank the government, the Ministry of Health, for your leadership on this. And I would also like to offer my sincere appreciation to everyone who's been involved and look forward to working together. Thank you.
Thank you, Susan. Before we go to Q&A, just a couple reminders. If you want to queue up for a question, please hit *1 now. For those who have already queued up, please unmute your phone. You will not be heard until we open your line. To start, we are going to John Crawford with CFTK. John, your line is now open.
Yes, thank you very much. One of the questions I have is with regards to mental health services, and I'm wondering if that's kind of involved in what we are announcing today. You know, as you know, with First Nations, social gatherings are very, very important, you know, whether it's funeral feasts or, you know, that kind of thing. And obviously during this situation, we're not allowed to do that, or First Nations are not allowed to do that, or discouraged from that. So, which could lead to things like domestic problems and others. So are mental health services also being included in this, and is there a go forward on that as well, perhaps in the long term?
You for the question and some very good points. Firstly, just on the traditions of large gatherings, whether it's to celebrate new life or to celebrate the passing of a life, these are profound parts of Indigenous life and culture, and they have been transformed because of the situation we find ourselves in. That leads to a whole host of challenges. Dr. Behn Smith talked about the importance of elders to the passing on of information and understanding of the past to better prepare Indigenous communities for the future. And so Judy Darcy and I made an announcement right here last week on an expansion of mental health services while we are in the COVID-19 pandemic. But you'll also know that mental health and addictions, the Ministry of, was established just 3 years ago with the very view that you suggest, that in difficult times, whether it be economic challenges, whether it be fires or floods, as Minister Fraser referred to, the various challenges that we've seen in the 3 years since I've had the honor to be Premier, has been an extraordinary impact on the well-being, the emotional and psychological well-being of British Columbians. And so we're always mindful of the mental health challenges that people are facing. There's a better understanding broadly across communities about that. Stigma is being reduced all the time, and that provides opportunity. As Dr. Behn Smith said, there's always opportunity to improve, and we'll do what we can particularly when it comes to delivering mental health services in rural and remote communities, but it's not confined to just those areas. Mental health is a challenge for all of us right now, and we're mindful of that. Judy Darcy is very mindful of that, and we're working across government, as we've said from the beginning, to find ways to promote program delivery across ministries, across the province.
Thank you. Next, we have Scott Burks from Moose FM. Scott, your line is now open.
Hi. Knowing that there are reports of COVID-19 cases on the Blueberry River First Nations, I'm just wondering if the Chief has been kept in the loop on that.
We have been working through Northern Health and the Public Health Office to ensure that whenever there is a new case, Dr. Henry and Minister Dix are available daily. Save for Sunday, and even then the reports are released. We're providing clear and transparent information to British Columbians and Canadians as we proceed through the pandemic. When it comes to isolated cases in isolated areas, we always involve a broad cross-section of the public, and that would be the case in Northern Health as well.
Thank you. Next, we have Lisa Yuzda from News 1130. Lisa, go ahead.
Hi, Premier. Asking about the pressures that we may feel here in BC when people are watching American states easing restrictions sooner than we are. We see the protests that some people are having, even down just in Washington state. How concerned are you, and what can be done to try and, I guess, prevent that from flourishing here and keeping people towing the line and 100% all in, as Adrian Dix says?
Well, I firmly believe that the overwhelming majority of British Columbians are on the same page when it comes to bending the curve and working hard to ensure that we're protecting our communities now and into the future. And any movement away from the collective efforts that have been successful could compromise all of that success and put us back into a place where none of us want to go. I'm confident that the public, the vast majority of the public, are with us on that, and I credit the leadership of Minister Dix and Dr. Henry in giving a sense of confidence that we are acting based on science. We're not going on hunches. We're not going on pressure from a particular stakeholder. We're looking at the science. We're making decisions in the best interest of all British Columbians, and we're currently seeing high levels of support for that. Now, there's not unanimity, and that's to be expected. In terms of how we will proceed with the relieving of various restrictions, that will again be directed by the science, and we'll have more to say on that in the weeks ahead. But I answered a question last week on a radio program about whether the federal government in Canada would be instrumental in clicking a switch and all of a sudden life would change. And certainly I speak regularly with the federal government and my provincial counterparts from coast to coast to coast, and we will take their views into consideration. But British Columbia will make choices for British Columbians. And when it is safe and appropriate to do so, that's when we will make those changes. I am in touch with Governor Inslee in Washington State, and the whole notion of the Cascadia corridor, how we could potentially all move in unison on a range of issues between California, Oregon, Washington, British Columbia, and Yukon is something that we're working on all the time. I think now more than ever, we want to have a kind of a unity of purpose. I know all of the three southern jurisdictions are counting on British Columbia to lead the way in Canada, and certainly I've been in regular contact with Premier Sandy Silver in Yukon, where we have reciprocal relationships with border communities accessing services in Yukon. And then, of course, if there's a need to evacuate to a larger acute care facility, Yukoners can count on British Columbians to be there for them. So we're going to take a regional approach to this, obviously mindful of what the Canadian position is, mindful of what's going on in the eastern states or the southern states, but most importantly the western states. And I'll take my direction from Governor Inslee rather than the federal government in the U.S. Guidance, rather, not direction.
Next, we have Jennifer Saltman, Vancouver Sun. Jennifer, your line is now open.
Thank you. Premier, I'm wondering if you can describe how the province will be helping TransLink to get back to regular service by fall and ensure its long-term financial sustainability, and why help isn't coming sooner to prevent the cuts that were announced today.
Thank you for the question. Well, we've seen an 83% decline in ridership over the past number of weeks with respect to TransLink, a 75% reduction in ridership for BC Transit in Victoria and Nanaimo and Kelowna, Prince George, and other BC Transit communities, and a 91% reduction in passengers on BC ferries. These very important transportation links within BC, public entities, all of them in one variation or another, are in crisis right now. And I raised last week with the Prime Minister and other premiers the need to make sure that when we're looking at wage subsidy programs for the private sector, as we've done with airlines, for example, private sector companies, we should also look at our public entities who depend on a fare box or a direct subsidy from taxpayers, either at the provincial order or the municipal order. We can't sustain an 83% reduction in ridership. That's just not going to work. So we need a national response to our transit challenges as well. Whether you're in Calgary or Toronto or Montreal or Vancouver, or anywhere else where there's public transit being delivered, this is a national interest. I tried to raise that in the federal provincial meeting, and I look forward to a response from the federal government in short order. But we need to work on this together. You've heard already mayors from the Mayor's Council and those that are on the TransLink board expressing their frustration at the absence of resources. But, there are absent resources in every sector of our budget, in every corner of British Columbia, and we need to be mindful of that as we collectively come out from underneath this. And that's where our federation, I believe, has an important role to play, and I've made that clear to the Prime Minister.
Next, we have Tanya Fletcher, CBC. Tanya, go ahead.
Thank you. Hi, Premier. We've now heard of cases in remote areas like Alert Bay. So is the timing of today's announcement due to more immediate concerns about rural clusters, especially since, those first modeling projections show that one of the biggest threats would be a possible outbreak in rural places that may not be as well equipped? And just kind of a sidebar to that on the threat of protecting the most vulnerable, hearing concerns from the downtown east side, renewed calls from the City of Vancouver and First Nations for more housing and shelter. So what are the plans for hotels secured for the homeless?
Several questions there, Tanya. Thank you for that. Firstly, we accelerated this announcement, which, as I said, we've been working on for a number of years, because of the pandemic. No question about that. We felt it was more important today than it was 3 months ago to make sure we were sending signals to rural and remote and Indigenous communities that if they needed access to acute care facilities, largely in urban centers, they were going to get that access. So absolutely, we accelerated this announcement because of the current situation. But the benefits to our primary care network across the province as a result of the work that's been done is really going to be a future-looking exercise. And although we're focused on the immediate, the future is why we are developing these initiatives and working collaboratively across the regional various health authorities and with communities. When it comes to the challenges of physical distancing in areas of homeless and marginal populations who are hard to house, I've tasked Minister Shane Simpson to address those issues, and I'm confident he'll have something to say by week's end on those issues. But we have been working again with municipal governments about how we can work together to address these challenges. They were, again, as with challenges of accessing health care from rural and remote parts of BC, these issues existed prior to COVID-19, and we want to make sure we take advantage of the opportunity, this unique opportunity of all of us working together, a set of common purpose that I've not seen in my adult life when it comes to delivering services for people and making sure that we put the priorities of citizens wherever they may live at the top of the agenda. This is an unprecedented opportunity, and I'm hopeful that we'll be able to make positive strides for the lives of all British Columbians in the days and weeks and months ahead.
Next, we have Richard Zussman, Global News. Richard, go ahead.
Premier, I have one question for you and one question for Dr. Behn Smith as well. Premier, on the education file, we've heard a lot from Dr. Henry over the last few days about a gradual reentry. Do you believe that this gradual reentry can happen in this school year? And what stands out to you as the potential challenge with splitting classes in terms of the burden that puts on teachers or students? And for Dr. Behn Smith, I'm just curious about a separate topic, a study done in Boston in terms of the most at-risk populations being tested. And they ran a test and found there were a lot of people in their homeless population there that tested positive but did not show symptoms. Are there any concerns that there could be something similar happening in the downtown east side or other communities here in British Columbia?
Thanks, Richard. Firstly, on how we are looking across governments at how we will lessen restrictions in the weeks ahead. The Minister of Education, Rob Fleming, has been working with stakeholders, the BC Teachers Federation, superintendents, trustees, community leaders since the announcement of the curtailment of in-class teaching some weeks ago. And we're assessing how effective the virtual learning process has been. We've made significant investments to get technologies into the hands of young students who don't have access to broadband, don't have access to Wi-Fi, don't have access to technologies. We're doing everything we can to give those students the tools they need so that virtual learning can be a success for them as well. And I don't want to get in the way of the work that's being done in the sector. Again, a level of collaboration and cooperation that's quite unprecedented in my adult life, to see all of the stakeholders in the K-12 system working hand in hand for best outcomes for kids. This is what we all hope for, and this is what everyone in their various components always strives to do. So I'm going to leave the science to determine how we come out from underneath where we're at, but I am very confident that Minister Fleming and all of the stakeholders that are so passionate about public education are doing everything they can to deliver service today, and when they get the opportunity to return to something closer to normal, they'll all be very excited about that. I have a daughter-in-law who's a teacher and a niece who are teachers, and we Zoomed on the weekend. This is the second weekend in a row where both of them have been overjoyed with the ability to teach and connect with their kids, the excitement in the voices of the children as they're interacting with their friends that they haven't seen for weeks, even though it's in a virtual technological way. It's exciting for young people to reestablish those relationships and get back into learning. And I'm going to hold that as a hopeful prospect for our future, that virtual learning is here to stay, but it's not going to be the only way we learn. But these technologies, whether they be applied to rural and remote and Indigenous community health delivery, or they're applied to education, whether it be K-12 or post-secondary, I believe that the technology has now arrived. We're embracing that technology, and we'll all be better for it.
Masicho Premier and Masicho Richard. I have an 8-year-old daughter who attended her first virtual birthday party yesterday, and I can attest to the need for that social connection as a part of children's mental health. To your question, Richard, thank you so much for raising that. I saw that study yesterday, and I was also very intrigued by the findings, and I'd like to comment on 3 things. So the first would be just to draw attention to the revised testing guidelines. The second would be to illuminate the proactive surveillance that's been happening in the downtown east side for many, many weeks. And the third is to speak a little bit to the testing limitations and the epidemiology that we understand today about coronavirus. So firstly, I just want to acknowledge that last Wednesday we did revise the testing guidelines provincially, and we specifically named homeless and unstably housed people as being part of a priority group for testing. And we did that because we recognize, again, the devastating impact of early clusters in vulnerable populations. The second piece I just want to draw attention to is that many of the Health Authority emergency operating centers have stood up vulnerable populations working groups that are specifically thinking through and operationalizing measures to ensure that vulnerable populations are protected and taken care of during this time. So for example, in Vancouver Coastal Health, I know that they initiated a very proactive surveillance system many, many weeks ago, where they're doing geospatial tracking of symptoms and going out and doing proactive swabs. Luckily, to this date, there have been very few cases that they've identified in the downtown east side, and certainly we hope to keep it that way. More specifically, Richard, to your question around asymptomatic transmission or spread of COVID-19, this is a new virus. We're learning more about it every day. And so we certainly are becoming aware that asymptomatic transmission or spread of the virus can happen. At this point, it doesn't appear to be driving the epidemic. And so we're aware of that. There is a limitation in the testing in that if we test people who are asymptomatic, we can get false negatives. So we could get a result that says somebody doesn't have COVID-19 when in fact they do. So that is one of the limitations, but again, it's an honor to be here today and be able to speak to this announcement about really deploying easier access to rapid testing, and that's going to help us detect cases earlier and put in place the population health measures to keep everybody safe. Masi.
Thanks very much. Next, we have Maria Weisgarber from CTV. Maria, go ahead.
Thank you, Premier. Just hoping to follow up on a question from Jennifer Saltman regarding TransLink. I know you said you're hoping for some sort of partnership with the federal government on this, but so far TransLink has said they haven't received any funding commitment federally. However, they have said that in discussions with the province, they've received some sort of assurance that there's going to be assistance, particularly to help hire back some of the nearly 1,500 workers that have been laid off as of today. So what specific funding assistance is the province going to be giving to TransLink?
Well, what we've been doing from the beginning in our response to the COVID-19 pandemic and the crisis that's ensued is to work with the other order of government, the federal government, who have the greater access to resources that can be deployed across the country in an equitable way. We've tried to work with them to ensure that where there is a gap, we will step in. One area of that would be we're the only province that has a rental supplement. We saw that as an emerging challenge and one that we needed to fill immediately. When it comes to issues about maintaining services like BC Transit, TransLink, and BC Ferries, all, in my opinion, equally important to the well-being of British Columbians and to the BC economy. And when we come out from underneath the restrictions that are in place with respect to our economy, we're going to need those services to move people back and forth from their homes and to their workplaces. But they're going to want to be comfortable on those forms of public transportation. So we have a whole lot of work to do, which involves those employees that have been let go. And we need to make sure that they don't go far away from British Columbia and from their access or their direct connection to the services that they've been providing, whether it be on ferries, buses, or SkyTrain. So we have a package, as you know, of $5 billion so far that we're managing on behalf of all British Columbians to get through this crisis. But when it comes to TransLink, particularly where there is, as you know, a unique, one way to describe it, certainly an innovative partnership between various orders of government and the riding public, whether it be the fare box, whether it be taxation at the municipal level or direct contributions from the province, which has kept the system going, and it is quite a vibrant and dynamic system. But we are severely challenged right now, and we need to make sure that as we come out from underneath that challenge, if there are other partners that can join us, and the federal government has joined us on capital announcements. The Prime Minister and I were very excited to make an announcement about expanding SkyTrain both south of the Fraser and out towards UBC. It seems like 1,000 years ago now, but it was less than 24 months ago that we made significant announcements. So if we can talk about capital together, I believe we should talk about operating costs together as well in these unique circumstances. And I believe that there is support across the country for that. I'm not diminishing the province's responsibility here. I'm just seeking to spread that responsibility to other partners so that we can maintain these services, keep people working as long as possible, and once we relieve the restrictions, get people back to work using public transportation, which is, of course, part and parcel of our climate action plans as well.
We have time for one more question, and for that, we're going to Vaughn Palmer, Vancouver Sun. Vaughn, your line is now open.
Good day, Premier. The Economic Recovery Task Force, which has been appointed a little while ago, I'm wondering how soon can people expect to see a recovery plan announced by the task force? And I'll just give you an example. The retail sector, we already see pharmacies, grocery stores, liquor stores, and some retailers operating under the new rules for physical distancing. How soon could a plan be laid out so that other retail stores could go open up on the same basis?
Well, it'll be a while yet, Vaughn. I don't want to engage in too much speculation about that. The science will determine, and Dr. Henry and her team will determine at what point we can start implementing the recommendations we're getting, not just from the Recovery Task Force, but across sectors and across perspectives on these issues. But I'm very pleased with the work, the collaborative work that's being done by the Recovery Task Force, which, of course, as you know, has a range of business groups that represent hundreds of thousands of businesses and employees across BC. Organized labor is there, not-for-profit organizations are there, Indigenous people are there, and it is a reflection of the challenges we're seeing not just in our retail sector, but in every sector of our economy. Big challenges when it comes to tourism, which is an area that we continue to focus on because it has been in many ways the salvation of some former resource communities when they have the abundance of natural beauty that can attract people from around the world. That's going to take some time to rebuild. So we need to start talking about not just the retail sector, not just the resource sector, not just health services and other basic services that people depend on, but the broad cross-section of economic activity that makes up what was one of the most dynamic economies in North America until just a few weeks ago.
Thanks very much. This concludes the Premier's press conference. Good afternoon.